Hey guys, this is Patience. Actually, I'm just gonna do an update. I know you guys haven't seen me in a minute, but the update is for Sonya's surgery. She is about Monday to be 2 weeks, and my gosh, it has been like um, I've been busy. I'll put it that way. You guys know I'm a nurse by profession, and I feel like a nurse at home. Is that good to say? But she's doing good. The first couple of days was kind of, we stayed like 3 days in the hospital. We had to stay an extra day because she had some blood pressure issues, and oh, it was kind of scary just to be on the other spectrum of patient care. And anyway, um, just because I think she had two surgeries at one time, which made it far more difficult for the body. She had some adjusting to do. Um, but this is the end of her second week. The first week was she was very weak and needed a lot of assistance. This week has been much better. She's getting around somewhat better, but she's still weak and trying to get back to her activity as normal. As for me, I have just been doing taking care of her, just taking care of her this week, and making sure everything is good for her. Um, Thanks so much to her family who was very supportive, and we stayed there for the first week and a half. And all I had to do was worry about her, getting her straight and cleaning her up, and just taking care of her, which they were so helpful, and it made a big difference in getting her better. um she had a little setback, but that's okay. She's back on her feet, and so am I. um I go back to work. I was supposed to go back to work this week, but I had to take off another few days just because we were at home. um let's see. Oh, guys, you know what I didn't show you guys? I got a tattoo. A couple of weeks ago, I went to a tattoo party, and here it is. I don't know if you guys can see that. I can't. You know what? I don't know how to zoom. It was supposed to be bigger than this here, but once they got started, I couldn't deal with the pain. The pain was awful. So it was supposed to be a butterfly, but it turns out it looks like a little bee. But anyway, I did experience that tattoo experience, and I don't need another one. Um, what else going on with me? My weight still, surprisingly, I hadn't worked out in almost 2 weeks, which is like killing me. But my weight is about the same. It's like 165. Well, not the same, but it's in the same range. Um, and I'm kind of happy with that. I saw another plastic surgeon this week, which was kind of interesting. It's the one that my lap band doctor uses, and this thing is like so. I mean, there's so many different spectrums of this whole plastic surgery thing, and I guess you really have to be informed. Sonya's surgery wasn't extensive as what I need. I keep saying tummy tuck, but she had a paniculectomy. It's hard to get out, and that's where they just cut off the bottom portion of your stomach. They don't do any like reconstructive things with the muscles and whatnot. And from the last surgeon that I saw, he was saying that he could just do me an incision across the bottom and, and do my legs with the upper portion. And this doctor is he is double the cost of the surgeon that my coworker knows. But he wants to do a fleur de lis procedure. I was thinking, okay. But that involves, so I'm a little confused of what I want to do because he says the way my fat is in my belly, if I don't want to have the saddlebags on the side and a pouch in the middle, then I need the incision up the front and down below, which means they're gonna cut me down the middle, open me up, tighten my muscles, and he says to um, pull in the waist, and make me have a little waist. Whereas the other doctor said I won't have a defined waist. This doctor says he can give me a defined waist by doing the fleur de lis procedure on me. But when I first started out thinking about plastic surgery, I really wasn't considering the fleur de lis because I said I didn't want to be cut down the middle. But this is getting a little confusing for me. And as far as the thigh, his preference with doing the inner thigh is to cut down the center of the leg just to lift the inner thigh. But he said you wouldn't see it. And I think I'm a little confused on that because, of course, I didn't want to be cut down the inner thigh, but I want the surgery to be effective and I want it to look nice. The only thing that I really like about, using the guy that's doubled the cost is that because even with Sonya's experience, I don't know if I prefer to pay the extra cost, the extra fee, because I get, a night stay in the hospital. And you also get like a pain pump. I don't know if you guys heard of the Q pump. It's something that they implant underneath your belly, and it controls your pain. And I like that because I am not a very good person for pain. Um, anyway, and then he was like, well, okay, I can submit your thing to the insurance for, they'll pay for the, anyway, let me tell you how much he was charging. This doctor says it'd be like, I guess, $18,000 to do my thigh and my belly. I was like, what the? Oh, I'll be forever trying to get the surgery. So, but the only thing I like about him is that, so I may have to bust it up into a thigh and an abdominal surgery because he is, he has an outpatient facility, but I'm sorry, I'm just yawning. He has outpatient, but for 2 surgeries, he do it, you get a nice stay in the hospital, whereas the other doctor, he has strictly outpatient, and I feel more comfortable, I think, with staying in the hospital, only because of infection, and you're able to get antibiotics, for 24 hours. And especially if I'm gonna do a fleur de lis where they're gonna split me down the middle, open up the bottom, I want the best possible infection control that I could possibly have because that's probably one of the greatest risks of having one of these surgeries done. And I think that's it right now, only because I like the doctor. They're like just submitting my stuff. So I'll let you know how that goes, which if insurance approves for the paniculectomy, then it only takes $1,000 off its cost, which would make my tummy tuck cost $8,000. So we'll see. I may see one more doctor and see but I just, I don't know, just given with Sonya's experience, I think I just like the doctor. So anyway, that's my update. Thank you.